Well, to reduce battlefield fatalities in Afghanistan, the U.S. Marines Medical Corps have developed a new way to bring the hospital to the battlefield. The Forward Resuscitative Surgical Systems, or FRIS for short, brings everything from a modern hospital to a tent to the battlefield. And today, Marines and Navy corpsmen conducted a drill at Camp Pendleton. San Diego 6's Gary Buzel spent the day with them and has this report.
IED blast, bilateral amps, hypotension, bleeding, tourniquet supplied, break.
The sound no Marine wants to hear come over the radio in the battlefield. Several Marines seriously injured from an IED or improvised explosive device.
Inbound, stand by for mission report.
This call for help sets the 1st Medical Battalion at Camp Pendleton into action. Fortunately, what you're watching is a mass casualty drill.
You train this enough, it gets to muscle memory.
Chance to practice it here, you get to practice it almost every single day. We work every single day, the planning to go. We talk about disasters, whether it be overseas on the homeland here.
Part of the preparation is adjusting to the ever-changing severity of injuries seen in combat.
The degree of injury and the pattern of injury that a lot of the wounded are receiving today are quite horrific.
And because of these injuries, a system was needed to treat patients closer to the front lines. This is where FRIS, short for Forward Resuscitative Surgical System, was developed.
So as soon as they come from the battlefield, they come here.
The FRIS and shock trauma platoon tents can be deployed in the field by helicopter and set up in hours.
We are rapidly mobile, highly deployable, and can be at most any place in a very short moment's notice.
Inside these tents, you find everything in a regular hospital emergency room.
This basically is the holding area where we can hold our patients. We can hold the patients up to 72 hours here.
Many of the personnel participating in this drill just returned from Helmand Province in Afghanistan, where their patient survival rate was 98%, which can attest to how effective this program is in real combat.
Got to do everything we can to get them home.
With the 1st Medical Battalion at Camp Pendleton, Gary Buzel, San Diego 6 News.